Hello, everyone, and thank you for joining us. My name is Melinda Smith, and I'm the Executive Director at HelpGuide. Today, we're going to be talking to Dr. Jody Thomas about COVID in kids. Dr. Thomas is a licensed clinical health psychologist, a specialist in pediatric medical illness and trauma, and an internationally known expert in pain. She's the founder and executive director of the MEG Foundation, a nonprofit whose mission is to empower families with the pain management skills and support they need to advocate for their children and minimize pain and trauma in medical settings. She's also a founder and former clinical director of the Packard Pediatric Pain Rehabilitation Center at Stanford, as well as a former assistant professor at the Stanford University School of Medicine and current adjunct faculty. She is also an active consultant for the Lucille Packard Children's Hospital at Stanford. Dr. Thomas, thank you so much for being here today.
Thank you so much for having me. I'm excited to do some talking about some stuff.
Yes, we are too. Quickly before we begin, a quick note that this webinar is for educational and supportive purposes only. It's not intended to be therapy or treatment. If you need more help, please visit the HelpGuide website at helpguide.org, where you'll find mental health and parenting guides and resources. You can also visit the MEG Foundation at megfoundationforpain.org to learn more about supporting your child during doctor's visits and medical treatment and preventing unnecessary pain and trauma. Following the discussion, we'll have a Q&A. So if you have any questions, feel free to add them in the chat and we will get to as many as we can. Finally, a recorded version of this webinar will be available, so watch for that link in your email. All right, so with that said, let's jump in. As we said, we're here today to talk about COVID in kids, and we're in the beginnings of a school year that just a few short months ago, we expected to be relatively normal. You know, we had the vaccine, things seemed to be getting under control, you know, things were opening up. And then the Delta variant changed everything. So that's been quite a pivot for people. And, you know, it's been reassuring to see how well the vaccine is preventing severe illness. But for now, kids under 12 still can't get vaccinated. And so a lot of parents are worried. And, you know, everyone wants to keep their children safe, but there's a lot of confusion about how to do that. And I think a lot of parents feel they're stuck between a rock and a hard place. You know, they're worried about the risks of COVID in school, but keeping kids home has repercussions on their mental health and their education. So it's, you know, it's not easy. So Dr. Thomas, what advice do you have for parents who are trying to navigate these decisions?
It's first, I will tell you that it is simply not easy, right? And it's not easy to begin with, and it's not easy now when, frankly, we're all just exhausted. And I have my own kids who are in, you know, 3rd and 4th grade, so I very much relate to this, both professionally and personally. And one of the major fatigues that we're all experiencing is this decision fatigue, having to constantly make decisions that are really about core safety. And we're simply not used to doing that. Like pre-pandemic, we didn't spend a ton of time on a daily basis pondering our basic safety on a daily basis. We had, all right, here's what we do. Here's our things. We put on our seatbelts, we're in the car. We look both ways before we cross the street. We accept that there's going to be some colds during flu season, all the things. And all of a sudden we are tasked with sort of a constant moving target of how do we determine safety for ourselves and likely even more stressful, our kids.
Right.
You hit on some really important things. And of course, this all feels incredibly disappointing. And by the fact that we all were like, great, vaccines, fantastic, wonderful, great, we'll be in school year, great. We were finally, I mean, as every parent, I think, was like, okay, we can count on them being in school. And we're like, never mind, we can't. Oh my God, this is terrifying. I don't want to do this again. And, you know, the good news, if we kind of step back from that for a second, is that we know more. And we know more about the implications of keeping kids home. We know more about remote learning. And we also know more about, you know, the the virus and how it's transmitted.
Mhm.
There was a point where we had no idea like the level of contagion by touch, and now we're so much more clear on the airborne nature of it. So our ability to protect is very different as well. And so when we talk about that decision making piece, what we want to do, it kind of goes back to that fatigue. We can't constantly have to reevaluate it, because that is truly what just drains our soul, it feels like. And so one of the things we talk about is having parents decide, having people decide where are their trusted sources of information, and trying to check in on those on a regular but limited basis. So if we sat there and listened to every piece of information that comes on, whether that's on social media or the news or whatever, on a regular basis, we are constantly going to be questioning any decision we make. And to be able to say, look, we're going to step back, and as a family, as a parent, as a couple, whatever that is, and make a call on what we want to do. Because the rest of it, and because it's really a risk assessment. We get zero guarantees. That's what we would all love. Human beings, we love certainty. We want to know if we do A, then B is going to happen every time. That'd be great. And if anything has proven that is never possible, then it's this pandemic, right? We don't get to predict any of the things. And so being able to say, look, okay, I'm going to the CDC website. I'm going to look at the HHS and trusted sources, frankly, like HelpGuide, right? That these are people who are just here to give me good, solid facts and data information, who do not have an agenda for me. So I would like to just go there. Based on that risk, we're going to make a decision. And because that also changes, if you're in a neighborhood where there's high vaccination rates and people wear masks, then that's going to feel like a different level of threat potentially than being in an area where masks are not as done or vaccination rates aren't as high. So that's the other part, is there is no one answer, which of course is the most frustrating thing I could say, right? Right?
Very stressful, yes.
If we're like, great, this is the one thing everyone should do, and that's the perfect answer, would be great, but it's not. But we have to sit there. And again, factors like, do we have someone in the family who's higher risk? Do we have kids who are under 12 who can't get vaccinated yet? So all of these factors are going to be into where is our risk assessment right now, and then do the best we can, knowing that it's always going to, be dicey, but being like, look, this is the call we're making. These are the steps we're taking to be as safe as we can at this moment, and that we've decided is good for us and our family, and try to let it go on a daily basis.
Yes, the letting go. That's
which I
easier said than done. But yes, no, it's great advice. I think a lot of us can relate, even from the way the pandemic started, when I know myself, I was researching all the time, just trying to figure out the news and different data sources. And it just, it's good to be informed, but there's a point when you're spending too much time on it, and it really is terrible for your mental health.
One of the phrases that we'll often use with patients is the difference between useful analysis and useless rumination. Where we're just thinking about this all the time, and there's really no other data that we can gather that's going to change anything.
Sure.
And being able to ask ourselves that question, okay, is this more useful analysis, or am I just spinning, right? And even having that meta moment of like, oh, here we are, here's the spinning again, and accepting that that's going to happen, right? Every time we go like, I don't know, is this good call? Did you? Like, I'm not sure. There's a YouTube family, it's just hilarious and somewhat embarrassing them even admitting this, that called the Holderness family. They make all these videos, and I laugh so hard because they made one recently to the tune of Call Me Maybe, called I Don't Know Maybe, about this issue of like, are we allowed to have play dates again? I don't know, maybe. Should we send them to school? I don't know, maybe. And it was this beautiful just encapsulation, I think, of where parents are right now, of like, look, I thought once we had these things in place, I'd be able to make these clean calls. Delta screwed that all up. Now I'm in the middle of like, I don't know, maybe, should we? I don't know. And so that goes back again to that like anchoring point of like, okay, these decisions we very concretely and with intention made. And the more we can kind of remind ourselves to center back to that anchor and being like, look, we're going to have to let the rest of that go. And these decisions we're making. And then, again, unfortunately, it's a roll of the dice. It's a numbers game at this point, which feels scary, which is why we're all very stressed.
Right. Kind of related to that, how do you, as a parent, how do you help a child who is too young to be vaccinated and, and they're anxious about returning to school or other extracurricular activities? What would you say to those parents?
I think it's a really excellent question, and one we need to be aware of, because these kids, one of the general rules in life, I will always say, is kids always know more than you think they do. Because when parents will say to me, like, well, we're really careful not to discuss it around them. I'm like, yeah, they know anyway, right? Like, and it's not that I don't believe they're being careful. Some parents are not, but a lot of parents are, but they hear the overheard conversation. They're hearing it at school. So one, like, don't assume the kids don't know and they're not thinking about it, because they are. And first of all, it's going to be almost a similar thing of going over them really concretely, whatever your plan is, right? Like, okay, so we're going to wear masks. Kids are stunningly good at managing masks and those things when they know it's going to get what they want. Like a lot of our kids wear masks 8 hours a day to go to school. Mm-hmm. And it's become, for a lot of kids, a non-issue, right? They're like, whatever, that means I get to be here and not sitting at home in my room and crazy with my computer screen. But being able to say, look, recognizing some of those anxieties, helping them go through which anxiety is reasonable. Like, I'm worried about, I'm worried about going back to school. I'm worried about not going to know what to do. I'm worried about whatever, versus ones that might not be totally reasonable. I mean, these are kids, and especially, 11 and younger, these are the kids who were still playing cooties on the playground, right? So we have to remember that there's a very developmental piece of this, of them realizing, hey, guess what? Actually, the risk of infection is pretty low, and that reassurance that kids don't often get very sick, right? Mm-hmm. And so really kind of helping them put that risk in perspective, mm-hmm. and very much emphasizing the things that are being done to protect them from that risk. Mm-hmm. And for kids who are feeling really anxious, you can give themselves sort of like a mantra of sorts, right? Like that piece of like, everyone's here to help me be safe and happy. Everyone's here to help me be safe and happy. Whatever those are. It sounds kind of silly, but that is the voices in their head. Basically, that we all have those voices in our head, and we're all sadly intimately familiar with them at this point in time in the pandemic. But what we want to do is give them a louder voice. And one thing I dare say is, do not say, don't worry. Okay.
Yeah.
As sort of like the phrase calm down, that has actually never resulted in someone being more calm in the history of mankind, right? We need to give them a reason not to worry, or not to hold on to that worry all the time. Mm-hmm. They're like, look, we're doing everything, your teachers are doing all they can to keep you safe. We're here. That's why, mom and dad aren't allowed in school right now. That's why it's just the kids. That's why you guys wear masks. That's why you wear whatever practices are being done, that we're putting that in perspective. Also on that line, really keep the TV off and the internet off around the kids. Like the sensationalism that sort of just is inherent in the media. Remember, all that data, they're not equipped developmentally or otherwise to understand and to turn into action. And so we need to be helping them assess that risk and anchor themselves in where they can be safe and okay.
Mm-hmm. Yeah, that's a really good point. I mean, for adults, it's stressful enough and difficult enough to assess. So point well taken. Another issue is that so many kids, they were home so long. And so now there are kids that have fallen behind academically, or they've become less comfortable socializing. Mm-hmm. What can parents do to support them through those challenges?
The academic piece, we'll kind of tackle that one first, is a great one, because everyone is behind. I mean, that was kind of the interesting piece and people like, I'm worried my kid's behind. I'm like, well, the good news is we are all behind, right? I had my oldest is third grader last year, and they definitely did not get through all of the multiplication tables by the end of the year that they would have normally, right? And so the first one is kind of check our own expectations at the door and to stand back and do an assessment of that for real. And this is when it's great to send that email to a teacher and be like, look, where is my kid on the spectrum of this? Because the truth is they are going to be, everyone's a little further behind. And ideally the schools are recognizing it, and certainly most are. So I'm getting an accurate picture of whether or not that's actually true or not. Everyone feels that way. Whether or not it's accurate is a whole nother question. One, just kind of checking in with teachers of where are they? Is this okay? But also being able to normalize this. Like, kids always know when we're lying to them. Okay, so parents, we say that, like, yeah, we're just gonna say the truth here, like, because anyway, right? And it's a fantastic time to illustrate how much we need our kids to be able to trust what we say and be like, yeah, you probably are, because you know what? You had to learn on a screen all last year. That's hard. And the good news is so is everyone else. And being able to say that in a way that is validating as opposed to diminishing, like, well, all the kids are going through it, so it's not a big deal. It's not necessarily helpful, right? And also then being able to break that down into like an action, like, how are we fine? Are we worried about our multiplication tables? Are we worried about that we can't do our reading? Are we worried about whatever? Because then it becomes something to do. Okay, cool. Then great. Let's find an app that can help us practice our multiplication tables. Let's work on practicing this thing that makes it difficult to keep up. But turning that general worry of, oh my gosh, I'm behind, into actual realistic assessment and some steps, because we always like to say that action is the enemy of anxiety. And if we have something we can do, then that feels better. But also encouraging for ourselves and our kids, just some, as we like to say, space and grace. Like, it's okay. We're good. On top of the 20 million things going on right now, again, pretty sure eventually we'll get the multiplication tables down, right? This will not be haunting us in 10 years. We're cool. But being able to do that. So on the flip side, the socialization piece is a really interesting one. Because depending where our kids are, that impact is a little bit different. Like we talk about right now, kind of like COVID babies. These kids who, I mean, one of my best friends had a baby during the pandemic. And when everyone was finally vaccinated and I can go visit, I was the first person outside of the pediatrician who had ever held this child besides your parents. And so there's this, wow, there's been no exposure, seeing faces. So for younger kids, it's very worried about those kindergartners missing last year, because kindergarten is so much about the social development, the emotional development, sharing, cutting, these very motor skills that they didn't get exposure to necessarily. And then for slightly older kids, there is this very much, how are we dealing face to face? How are we learning to give each other space? How are we negotiating the more complex dynamics of the playground? So, and again, here's the good news, everyone skipped, right? And so everyone's playing catch up, but also recognizing for kids, there is going to be some more anxiety. I mean, I remember for myself and going to the grocery store for the first time when I hadn't been for a really long time. And I am by personality not a highly anxious person, but just by a lack of exposure, just a weird look at how anxiety develops, that when we don't do something for a long time, it naturally is going to spark an anxiety response in us because we're still assessing for safety. And it's this very primal response. And simply we haven't done it. We're like, oh, is this okay? And that is where we can employ our very conscious brain to be like, yes, it's a grocery store. You've been here a lot of times before. It's fine, right? That we can let that, sort of our very conscious intelligent self override some of that primal self. And for kids, it's being able to kind of start slow. When we go from the only people we've seen in a really long time are our family, we haven't left the house, we've been on planes, to like the chaos of a classroom or a playground, that's a lot. So one, acknowledging that and seeing some of that overstimulation behavior that we can see in our kids where they seem really stressed because they are. So you are likely to see more of a need for downtime when they're coming home. And again, depending on the personality of your kids, some are like been so starved for social contact, they're super extroverts. And then the introverts who were super happy to be hanging out alone in their room were like, didn't really like you people before. Now I'm really overwhelmed by this, right? And so being able to do things like, if they're doing play dates at this point, depending on, all those risk factors too, like let's play with one kid instead of 10, right? Kind of a warm up back into that social world of, and helping them and coaching them, and also just articulating it, just saying things to them like, yeah, it can be really hard to be around a lot of people again, can't it?
Mhm.
Yeah, that makes sense. And
Right.
just using our words to give them a voice in their own head of why they're feeling like this,
Mhm.
that in of itself can be really, really powerful.
Yeah. So this is another topic, and a difficult one. Um, there's so many strong and conflicting opinions about different aspects of the pandemic, including, vaccines and masks and just, risk in general. What can parents do to prepare their kids for those questions, those conversations that they might encounter?
So it is a hard one. It is a really hard one. And I think one of the hardest ones is the fact that unfortunately, they're not just going to be getting it from other kids. We are almost bizarrely in this era where people will say things, adults will say things to children.
Mhm.
And which is frankly kind of the most disappointing. But I think one of the things we do, kind of even no matter where we're falling on the spectrum of any of these decisions that we're all tasked with right now, one, despite the fact that, yes, I know I just said that kids know more than we think they do, and they always do. But I also think it's really important to protect them from the high emotion of those situations. This isn't a time to be screaming at, the neighbor about whatever, or this is a great time to, yeah, we're gonna leave when things get elevated. It's a great time to tell grandpa that we're not getting in a large political discussion about blah, blah, blah in front of the kids.
Mhm.
That it's a really phenomenal time for us to set some boundaries to protect our kids from the heated and frightening nature of these discussions. So one, and modeling for them that ability too, because one of the things as they go out in the world is unfortunately they're going to be tasked at a level that we'd all like them not to have, to be able to draw those boundaries for themselves. And there's a real possibility that they will, like, even having people tell them that their masks aren't necessary, or that it's not real, or faking, which are really scary ideas to kids. You're like, the entire world is turned upside down, and now I have an adult telling me it's all not real. What am I supposed to do with that?
Mhm.
So one is preparing kids, and also asking them and checking in for what they hear. Because one thing we talk about when we're having just difficult conversation with kids at all is to step back and get curious about what they're thinking and where they're feeling, what they're feeling. Kids see the world from a very different perspective than we do. Okay. Not only do they quite literally have a different view, being lower, their level of exposure is different, but also their just understanding of the concrete nature of things is very, very, very different. And something we do often as parents is try to kind of think of every possibility of what they could be thinking or feeling or doing. And that's exhausting, and also usually pretty fruitless because usually they're thinking of something else, right? Where their mind goes is a totally different thing. We often talk about this when it comes to like having the sex ed talk with kids, and where they can ask a question like, where do babies come from? And we launch into a 20-minute lecture on the logistics, and they're like, No, I mean, like, why is the baby coming over here for dinner tonight? Like, we had no idea. And they're like, wait, what was that about? I was just curious about, like, whatever. So staying in that place of curiosity and being like, I wonder what you think about that. Similarly, when you ask them questions and they hit you with something, you're like, I have no idea how to answer this, right? That we don't need to answer that in that moment. And it's perfectly legitimate and a fantastic thing to have in your back pocket to be like, you know what? That is a really great question. And I want to think about that and do a little research, and I will get back to you on that, because that's such a great question. I want to make sure that we're answering it really well. And then you can go off to the side and panic and freak out and call your best friend. Or, go to HelpGuide or go to these places where you can have a trusted resource. But it because what we don't want to do is kind of give this rambling, scary answer, because again, kids always know, and they're aware when we've when we've been thrown off by a question, right? They're like, whoa. And what we don't want to do here is create where, if it's too scary a question for you, kids know that. And that just puts it back on them. And so then they kind of get this message inadvertently often that, oh, if I ask that, it upsets mom or it upsets dad or upsets. And so I don't want to upset them. So I'm just not going to ask it. But it doesn't mean they don't have it. And then we've inadvertently kind of put the burden back on the kid to hold that in a way that we really, really don't want them to.
Right.
A lot of those questions are just about staying in a highly curious place and really figuring out what they're truly wondering about. Which in a lot of these too is like, am I safe? I mean, a lot of it all comes down to, am I safe?
Right. Well, and that is a perfect segue into, the next thing that I'd like to talk about, which is a fear that most of us are probably not thinking about right now, but which has a significant impact on health decisions in general and the decision to vaccinate in particular. And so that's the fear of needles. This is one of your areas of expertise. And talking to you about it, it was just so surprising to me to kind of learn these facts and this background. As you had pointed out on a call, a team at Oxford recently conducted a very large research study, and it was published in June at the Journal of Psychological Medicine. Anyways, this blew me away. They concluded that fear of needles is a significant factor in up to 11% of people who are hesitant to get the COVID vaccine. So that was pretty shocking to me.
Shocking.
Shocking. Yes. And then just, needle phobia more generally, I looked, the statistics, and the studies indicate that around 25% of adults have a fear of needles, 50% of adolescents, and 63% of kids, which again, it blew me away. And, it's, can you tell us a little more about this, including why this is something that nobody's talking about?
Yes, I can. So the fact that no one's talking about it is actually, as you know, one of the reasons why we started the Meg Foundation, because this fear of needles, which often very much comes from these negative early childhood experiences with needles, which is typically around vaccinations. And that has developed in the statistics that you kind of just rattled off there, which are, again, shockingly high. And I will tell you that even within the world of pain, where I operate a lot, they're so shockingly high. Like, those things have been studied like repeatedly, because there's such numbers that are difficult to believe. And again, in the world of science, we like to go through and prove it again or disprove it, and really, frankly, work hard to disprove it. So we already knew that those experiences, 1 in 4 adults, and so that study out of Oxford was interesting because, of course, this was looking at adults. So we know that from the historical data that needle fear can influence our medical decisions. right? So everyone, even kind of right now, people listening might be thinking about, that person we know who doesn't do doctors, like grandpa doesn't do doctors, uncle whoever doesn't do doctors. Oh, my friend, yeah, she said she never goes to the doctor. Well, I'd be willing to bet quite a bit that they don't do doctors because they had a really bad experience as a child or since then regarding a pain experience. And so on the positive news side, before we get into this, is that they're really pretty simple, easy solutions to ensuring that our both kids have a better experience and things that we can do things for adults who already have this fear.
Mm-hmm.
But we definitely know it's an absolute factor. So even sort of pre-COVID, 60% of adults in the US did not get flu shots, which is a pretty high number.
Yeah.
And 1/4 of those would absolutely endorse and admit, which is a big factor in this, that the fear of a needle is why they wouldn't do it. They didn't want to deal with a needle poke. Now, it's one thing with the flu vaccine. It's quite different with something we're in the middle of a highly global pandemic, right? So that was why that piece of research out of Oxford was so valuable to us, because we know we had all this historical data, but then that question always exists. What does that mean in the middle of this completely bizarre time that we're living through? Does it still apply? And the data there very clearly said, yes, it truly does. So it's one of the reasons why we launched the Hack the Vax initiative, which is adult focused and young adult focused content. We are partnering with universities and colleges and nonprofit advocacy groups, because teenagers and young adults are particularly interesting in this, because that's where that 50% number comes in. And all of the kids who are young adults right now were born in the 2000s. And we know that we saw a burst in sort of needle fear and healthcare avoidance in the early 80s, when we started having a larger number of early childhood vaccinations. And then again in the early 2000s, when we saw another increase in those vaccinations. Now, to be clear, we don't think that the vaccine itself causes this fear. Go vaccinations, huge factor in public health, big fan. But really about the poorly managed pain and anxiety experiences around those early childhood vaccinations that increase that fear and healthcare avoidance. And that's what we're aiming to help out with. And so we used to joke that we wanted to do prevention, not cleanup, but then we got a pandemic, and then we were very clear on the long-term public health implications of this. And so that way we wanted to come in and really provide support to these other populations. Mm-hmm. But it is a major factor we know now in who is approved for the vaccine for the COVID uptake. It's going to be a huge factor for kids, especially as we're staring down the 5 through 11 being approved. And so it's a big concern of ours to make sure we're doing all we can to support parents and families to have the best experience possible should they choose to vaccinate their child.
Mm-hmm. So, to people who don't have that fear of needles, it's hard to understand. It sounds, the fear of a shot sounds trivial, like, okay, well, no one likes needles, but you can just sit down, get the shot. It's, get through it.
Suck it up.
Yeah, exactly. I mean, and that's what a lot of kids get, tough it out. And so how would you explain, this issue, and why pain management is important? Why, in the context of shots and vaccinations, and just, the management of the whole experience and approaching it in a different way?
It's an excellent question. We get this, as you can imagine, all the time. And I think people without this level of anxiety and fear truly don't get it. And it's not a lack of empathy. It's just, it seems bizarre. And so one of the ways I will often explain it, I'm like, if we sat here and put you in a perfectly dark alley and in the pitch black, and the feelings that would start to arise in you just out of a straight thing of like, we're going to start to panic. And there's a very primal response to that. And that primal response is very similar to the response we're going to see in people with really significant needle fear. And people are like, it's not rational. I'm like, of course not. Like, people with the fear would agree. Yeah. So I'm not sure if everyone's noticed, human beings are not completely rational beings, and we don't operate on logic particularly well. And we're not. And so one, there's a huge amount of shame and stigma associated with this. And so when you talk to an adult with needle fear, one of the number one things we got was, I don't know anyone else with this problem, which I'm like, statistically untrue unless you're a hermit in the woods. But we do not talk about it because it's embarrassing. There's a stigma attached to this. And I will tell you, it spares no one. We have the toughest men in the universe we could think of, or the toughest women in the universe, are still going to have this fear, the same as someone who one might consider even personality-wise more anxious or more whatever. And so one of the things that we aim to with the campaign is sort of raise awareness and put this topic on the table, because it's a thing, and it's a thing for a lot of people, whether or not they talk about it or not. And they are often shamed. They're shamed by family members. They're shamed by people who do not have this fear, who are like, whatever, suck it up. And you're like, it's not that simple. And if it were this simple, honestly, I wouldn't have started an entire foundation about it. This would not, that'd be great. I would be doing other things with my time. So it's important, one, and that's when we're dealing with someone, both as a provider, as a partner, as a person, is to deal with that with compassion and empathy and normalizing that. To be like, yep, not alone, super common, lots of, and if you actually ask, and you do us a favor, if you really want to prove it to yourself, ask people in your world, you're like, how do you feel about needles? You will get some stories. Mm-hmm. And one of the things that I'll do when I do trainings for providers, I'll ask them their earliest childhood memory. Mm. And 9 times out of 10, that will be a traumatic medical memory.
Wow.
So I remember my first memories being 4 years old and being held down for a blood test. And I can still see the stupid Muppets poster on the wall. And, and I'm like, guys, it's 40 plus years later, and I can still see that stupid Muppets poster. So, and again, I get lots of medical procedures. I actually do fine with needles now. I'm all good, but that it really sticks with us. So there's a very primal nature to it. So that normalization really goes a long way. Mm-hmm. So that piece is really, really big. It's one of the reasons we're in the process of filming a PSA right now with some high profile athletes and whatnot, to be able to get the message of, look, everyone, this is not weird. It's not normal. It's not a statement on your character. It's not a statement on your toughness. It's not a statement on any of that. It's a statement that, that didn't go well when you were little. And we'd really like to help you out with making it easier. And that's almost easier to admit when we can also be like, there is something to do about it.
Yes. Well, and that is the big question, because I think probably a lot of people are thinking, well, there's nothing you can do about it. You still have to get shots, So you say that isn't true at all. And there's actually quite a few things that people can do. So could you kind of, give us the basics of it?
Yes, absolutely. So one of our biggest sort of challenges as an organization is about kind of combating this idea that the freak out, we'll often say the freak out, because it really encompasses both sort of that anxiety experience and the pain experience and all of that around needles, is that people think it's a necessary evil, that it has to be bad. And that's providers, families, adults, kids kind of see this as necessary evil rather than something we can do something about. And there is, the number one thing, and kind of going back to that action is the enemy of anxiety, is having a plan, is doing something about it. So that's where we built out some fun technology. We have our websites really going through, and what they do is they guide someone through making choices about, when we have 40 years of research evidence, that's a lot of evidence that there are things that help. So the power of doing things like using topical anesthetic, numbing cream, the amount of people who are blown away by the fact that numbing cream is a thing and they can easily get it.
Right.
Mind blowing. And so you can get it over the counter at a drugstore, on Amazon, wherever. And you can there's prescription level you can get from your doctor, but over the counter, like 5% lidocaine, no problem. And we put that on the skin. So not only does it, one, truly prevent you from feeling a needle, it's not lying when they do the numbing cream, but it also makes us feel better before. because a lot of this is about managing the anxiety, the anticipatory anxiety. It's the ramp up that really gets us in trouble, right? Now, I'll say this too, that a lot of parents, and this is an incredibly well-intentioned, very common thing that we hear all the time, where parents will tell me, well, I just don't tell them we're doing it until we get to the doctor's office, right? And believe me, I can relate to not wanting to deal with that. And they're like, well, I just don't want my kid to get worked up and anxious. I'm like, yeah, but we pretty much guaranteed this is going to go incredibly poorly. I'll tell parents, I'm like, okay, think about sort of the most important meeting you've had in your life. Only we don't tell you about it till 2 minutes before. Okay. And they're like, and go. Oh, yeah. Okay. We are going to freak out. So the freak out is there. The question, like, I don't want my kid to feel anxious. I'm like, well, it's usually not a fair ask. So the question isn't, we don't want them at all to feel anxious or think about it. We want them to have a way to deal with that anxiety and a plan for managing it. So when we're like, great, I can use topical anesthetic, I can put that on my arm. I want to use vibration and Buzzy Bee, which I'm sure I have one around here a little. Here, I'll show you actually. I do. Sorry, I'm going to reach there. So things like this, which this is a little item, it vibrates, and you actually just put it on the arm for 30 seconds before and move it up for the needle to go in. And basically what it's doing is, one thing people don't realize is that pain actually happens in our brain. And so in order for us to detect pain, that signal has to get to our brain. And the vibration simply causes essentially a traffic jam on the nervous system where there's no room for that pain signal to get through because it's too busy kind of absorbing that vibration. So it's super simple. Also really interesting with some beautiful research that's come out recently. Adults worry about kind of passing out in the vasovagal response. Kids, that's much less common. But Buzzy and that vibration actually stimulates the sympathetic and parasympathetic nervous system in a way that actually prevents fainting as well, which is really interesting and phenomenal. So things like topical anesthetic, Buzzy Bee, distraction. As much as we like to tell people we want people off their screens, now is an awesome time to let your kids stare at the iPad, right? So there's not a parent on the planet, there's not a person on the planet at this point in time who doesn't know how hard it is to get someone's attention when they're staring at their phone, playing a game, scrolling through social media, whatever that is. And that their focus of attention is so caught that they literally don't hear you talking to them. Well, they also don't process pain signals the same way. And so it is a fantastic way to have them not only in sort of the pregame warm up, right? So we also want them being able to do that in the waiting room, that time when we're starting to start that freak out and that anxiety starts going up. Great, here, let's look at our tablet, our pad, our book, or whatever that is that's good and distracting that it can absorb. But it truly does change the way we process pain signals. And sometimes I'll illustrate for families and for kids by talking about, have you ever come home at the end of the day with a bruise and you have no idea where it came from? And you're like, yes, all the time. I'm like, yeah, something hit you so hard to give you a bruise and you didn't notice. And that's because your attention was so focused somewhere else that your brain and your body didn't even register that. And so if we choose where we're going to focus our attention, turns out we can make ourselves a lot more calm and comfortable and in control. So we have distraction, topical anesthetic, those things. Touch is incredibly important. Sort of my very big rallying cry is that kids should never absolutely be held down for medical procedures. It is in one way to cause trauma. And we don't want that. But that said, kids both need to be kind of contained in a way that they can safely get some sort of medical procedure done, but also that they can do that in a way that's comforting. So we have entire guides on comfort positioning, how we can hold kids so they also feel. So that actually touch with us actually, again, changes the way that their body feels. And we know it's that absorbing our energy. So for parents, one of the first things we say is to really work on calming themselves down, which is a tall order. I do not say that lightly. But we know a parent's distress is the biggest predictor of a child's distress. And so the more we can take those deep breaths, remind ourselves of that plan, remind them how we're going to cope, And then when we're holding them and we're breathing at a slow pace that they will automatically mirror unconsciously, and being able to kind of softly and reassure them and comfort them, then that is one of the most powerful things we do, especially for the younger kids, but also for bigger ones. I'm 100% here. Like, oh, they're too big for that. And I'm like, we are never too big to be comforted by the people who we trust and we love.
So how does, is there anything else you would do? These all seem like really great strategies for preventing a real issue with needle fear. What if you've already got a kid, that already has that focus?
Yes.
Then what do you do?
There's a lot. So one of the things too, again, definitively, please do not tell that kid before they're doing it. Okay. We got to give them a few days. And one, recognizing their fear, being able to say, hey, buddy, I know this is coming up. We know this is tough for you. That makes a lot of sense. A lot of kids have a hard time with it. Again, we want to reduce that shame, right? Normalize and reduce the shame. This isn't a judgment call. We're going to come up. Great news. We've got a lot of cool things that we can do. And we're going to have you choose ways to make this easier, better, faster. Okay. So anytime, one of the hard things about being a kid is that we do not have a lot of control and choice. So every bit of control and choice we can give. Now, as a parent, we might decide they're going to get this vaccination or medical procedure. So great. So we are going to make as many choices. We're going to go in what strategies we want to use. What can we do? And we're also going to practice them. That we are going to rehearse this like we would any other. And just anything else that's hard. We're like, cool. Okay, great. So we're going to do, great. We're going to do Buzzy Bee. Fantastic. We're going to get one. We're going to play with it. We're going to hold it on. I love Buzzy too, because you can demonstrate how it changes sensation by like scratching at the skin and then noticing how it's different. We're going to have them make their plan. We're going to have them choose a reward after. When parents like, it's bribery, I'm like, it's a reward for doing something hard. I am totally cool with this. Because not only is it one, we get a reward for doing something hard, it also gives us something to focus on besides we want to come out of this moment. This is not a good time to focus on our feelings. We would like to not have these feelings. So being able to choose that reward, have a plan going in. This is not a great time. One of the things for people with needle fear that was really hard at the beginning of the pandemic when vaccination was then they're going and standing in these long lines.
Oh, right.
Okay. And we're staring at people getting this done. You're like, this isn't helpful. So we want to filter the amount and prevent the time for upswing. So when we do plans for this with kids with pre-existing high levels of anxiety, this is when we want to make an appointment with the pediatrician. We want to sit in the car and not the waiting room while we're waiting for that appointment to happen. That we are doing our best to walk in and walk out as quickly as possible, that we're not waiting for that escalation to go, that we have called ahead to the pediatrician's office and said, hey, so this is what we're dealing with. This is the plan we're going to use. This is what we're going to do. Want to make sure you're on board. And we want to do this, even in flu shot clinics that are happening right now, because we're in flu shot season as well. It's kind of gotten lost in the shuffle of COVID, but still important. Is that sometimes they'll have kids come in and they're like, there's a ton of kids getting pokes at the same time, which means we're hearing kids screaming in other rooms.
Yeah.
This is not going to be helpful. Okay. So realizing this can be tough for different working parents to pull off and in different situations, but this might be a great time to be like, you know what, we prefer not to come to the flu shot clinic or the COVID vaccine clinic where there's a lot of other kids getting pokes at the same time. We actually want to do a separate appointment. And maybe that's even, hey, guess what? We're gonna leave school early, or we're gonna go school late. And we get to miss school. Yay, reward, super exciting. And we're gonna go when it's a mellow time, when there's time and focus to be able to create the most calm environment possible. We also talk about a concept with these kids called one voice, where when kids start to escalate, all the adults in the room start talking a lot. And that is not helpful. Okay. And so this is not useful. And so we talk about, so even in some of the game plans, and on our website, by the way, parents can find plans for how we can fill this out with a kid. And one of those questions of who do you want to talk and who do you not want to talk? Okay. And to have one voice rather than the chaos of, okay, yeah, no, it's fine. No, just sit down. Okay. I feel stressed out hearing, right? Right? You're like, I'm fine and I'm freaking out, right? So being able to create a sense of calm, have one voice talking when possible, and being able again to have that plan, being okay, buddy, remember you wanted to having them decide things like, do you want to look at the poke or not look at the poke? Some kids, and I will tell you, it drives me crazy that people are like, oh, you should never look at the needle. I'm like, actually, for a large number of kids, like my son is like this, he wants to see the needle go in because that's an element of control. He can see it and he knows that's okay. Now, if my daughter, she's like, I am zoning out. I'm watching Peppa Pig. I want nothing to do with you people. I'm going to be ignoring you all, right? Which is fantastic. Great. Good. Because that, by the way, is another one. We have to give kids permission to ignore. Like we're literally asking them to ignore this experience. So it's okay. Like normally we're like, pay attention to the adult, make eye contact, tell them, which are great. Yeah, that can go out the window for this. Actually, you can feel free to ignore the rest of us talking. That's fine. You do stare at your video screen. This is a time when I'm not going to tell you to turn around and look at the doctor. You go right ahead. You stay right there. We're going to be busy getting it done. So when we're talking about those kids with pre-existing, the more choices that we have, the more we can practice with younger kids. We can even practice with medical play. Great. Let's show you how our teddy bear, our unicorn stuffy is going to get this poke and reward. So remember, that is how kids work stuff out through our play. They don't have the same language development as adults. And so we do that through play and repetitive play. So when they have practiced it, they've been in the doctor role and given their stuffy the shot and the poke, and also practicing exactly how they want to, that they can do this on dad, they can do this on mom, they can do this. And every time they do, we get a little bit more of a sense of control and efficacy over how we want to do this. And then for kids with severe phobia, this would be a great time to, a psychologist, healthcare worker, somewhere like myself who has experience in treating true severe needle phobia. That's also very much on the table, and things like exposure therapy. The good news for anyone with severe needle fear, like really severe needle phobia, exposure therapy is a tremendously successful way of treating it.
And how long does exposure therapy take to kind of get over that phobia?
So it depends is the highly unsatisfying answer I have to give you. But a lot of that is about, it's kind of the amount we can do. So one of the frustrating things I know for me during COVID, a lot of exposure therapy can be like going into a doctor's office when you're not having anything done, because it's the point where, and I'm sure you think kids who like even passing by the parking lot, their pediatrician's office, they start to escalate and freak out. So unfortunately, COVID and some of the restrictions around it has made it tougher because exposing to the thing has been very reasonably restricted. But it depends on kind of the pace and how quickly and the severity of the fear. But we'll start out with like, great, if we know that a kid really does start feeling anxious before they even leave the house, great, cool. We're going to swing by. Great. Yeah, we'll go to Starbucks first and get a Frappuccino. And then we're going to sit in the parking lot for 20 minutes until it's super boring to sit here in the middle of the parking lot. Because we know that the natural evolution of anxiety is it escalates, but we cannot maintain it. And it will naturally go down. And that's really the essence of exposure therapy, is we're sitting there hanging with it long enough for that decrease and a reassociation into a not level of neurological arousal. So we're just sitting here being like, oh, well, we're cool now, fine. And then we're kind of pushing it further each time. Okay, great. Now we're going to go sit in the waiting room. Great. So like one thing, like if someone's sitting in my office, I have needles of all sorts in my office. and they know that it would actually be illegal for them, for me as a psychologist, to poke them with a needle, that we go from, hey, we see a picture, great, it's on the table, great, we're holding it, great, they're pretending they're holding it next to their skin, now I'm holding it next to their skin. So it's moving up this hierarchy of things that cause that anxiety in order to extinguish that fear.
We are getting to the end of the hour here. Any last thoughts that you want to leave us with?
Really, I want to just kind of leave people, I think, with the idea that that this is, of all the barriers and all the things that we have to deal with right now as parents and as people who are trying to take care of ourselves and our family and our community, this one we can help with. It's pretty simple. And we know that this is not a commonly known thing. Suddenly there's a level of interest that never was before. And we are really, the Meg Foundation, and there's certainly a lot of people and experts in the world who are also on that wagon, want to help. And so of all the things that are hard, we want to make this one easy, and we can. And so also we encourage people to reach out to us if they have questions. We would love to hear from them and support also medical providers and school districts and all these people who are looking to make things better and safer for kids.
Great. Well, thanks again so much for being with us today. And this has been just so informative, and I really hope it's going to help. I think it's going to help a lot of parents out there. So thank you again, and thank you all for joining us.
Thanks, everyone. Thanks for having me.